know that my work has been on chemsex, or that paired use of substances in sex. But my first book, Lust, Men, and Meth, was really that dynamic in gay culture and gay men. This is for everybody. This is combined drug use and sexual behavior for men, women, gay, straight, and not just amphetamines, but marijuana, alcohol, how they all relate. And more important, about a third to a half of the book is all on recovery steps, breaking down recovery steps and some sexual and intimacy recovery that goes with that as well. So I'm really excited about it. Very excited about it.
I've been lucky enough to see it. It's very in-depth and it's great stuff. So I can't wait for that to come out. Type your questions into the Q&A anytime, starting now. And with that, I'll turn us over to Dr. Fawcett.
Thank you, Scott. As Scott mentioned, I usually start with a couple of minutes of just education stuff. And this week, I came across a book. I've had it for a while, but I have gone back to it and just really kind of realized the brilliance of it. I just kind of want to talk about it in the main points as it relates to addiction, although it's not an addiction book. The book is called Atomic Habits, and it's by a guy named James Cleary. And it's the best book I've ever read on how habits are formed, what they mean, how they do, and mostly how we can undo them. And so I just want to really quickly go over kind of his main points, because I think they're really, really useful. So first of all, the definition of what he calls a habit is just something that we do it so often it becomes automatic. And it begins with trial and error. It usually begins with seeking a reward of some kind. And in addiction world, that can be the dopamine that goes with addiction, but it can be anything that we develop habits over. But the brain is analyzing, making decisions, and it's always busy and learning to try to make the most effective course of action. And then when you get a solution that works, the brain sort of says, wait, that felt good. What did I do right before that? How do I get back to this point? And so it's this pattern of trial, fail, learn, repeat until we get a solution. And what's so interesting in this, because we know the brain is always highly efficient. So as soon as we get a solution, much of the neural activity in the brain just kind of quiets down and we drop into this automatic pattern. We're not so conscious of it anymore. It becomes an automatic solution to getting that reward or whatever we need. And so the conscious mind, as Cleary says, likes to pawn off tasks to habits. So it doesn't have to, so it can be occupied with other things. It's frankly more interesting to the mind. So he talks, and this is what's so great. He has 4 steps to building a habit. The first one is the cue. And that cue is noticing the reward. And in our case, I'm going to put this in the addiction concept. That reward is that dopamine hit that we get from sex or gambling or porn or amphetamines or even other kinds of drugs. It's all dopamine related. All addictions are. So this reward thing that cue is a bit of information that predicts a reward. And the mind is always scanning. Our brains are always looking for ways to get that little dopamine hit. So that begins a cue. And a cue, by the way, is not in and of itself a cue. Cues, especially with sex addiction, are notoriously random because with dopamine, high levels of dopamine with chemsex, porn, and sex addiction, we can connect anything to our addiction. So anything can be a cue, not just a sexy person or a sexy image, but it could be leaving the office at the end of the workday when we usually act out, or feeling lonely, or feeling great. I mean, anything can be associated with it. So that becomes the cue for it. And then the second stage is the craving, which is that wanting reward. The brain takes over, and that's really where dopamine takes over and becomes a star. And this is so important because we say this a lot here too. What you crave is not the habit itself, but the change of state that it delivers. So when we talk about sex addiction, it's not about wanting sex or the sex. It's about the relief and the numbness and the escape that comes with acting out sexually. It's about the dopamine and a way to numb out and soothe ourselves. It's not about the sex. So I'm going to say that again. So it's so important. What you crave is not the habit itself. It's not the act of doing the habit, but the change in the state that the habit brings us. And that could be relief, it could be soothing, it could be numbness. So, and those cravings differ from person to person. So all this is really individually wired and tailored. The third part is the response, getting the reward, the actual habit that delivers us that dopamine, the action that we do to get there. And then the fourth is the reward itself, which is the end goal, what Cleary calls the end goal. And the first purpose of the reward is to satisfy that craving. And rewards also teach us which actions are worth remembering in the future. So that's how we build habits. That's what addiction is. That's what kind of starts to take over our lives. But what's so great about Cleary's book is he talks about how do you undo a habit? And I just want to mention that. So he takes each of those 4 steps and kind of puts them in reverse. So the cue, that first cue, he says the goal there to break a habit is to make it invisible. So we reduce the exposure to the cue. So if you're continuously feeling like you're not enough, you stop feeling that, or stop rather reading the social media accounts that trigger that, right? So we in other words, we take care of what that cue is doing. Another example, if you're wasting too much time watching TV, move the TV out of the bedroom. You know, just so we can make basic changes like that that kind of take the power out of the cue itself. The second one, craving, said make it impossible, or sorry, make it unattractive. So you think you're quitting something, but you're not quitting anything because cigarettes do nothing for you. So if you say, I want to quit cigarette smoking, I kind of really look at the reality of it. Cigarettes don't give me anything anyway. What's the value? You think smoking is about relieving stress, but it's not smoking. It's really killing your nerves, right? And as a CSAT, we have a technique called fantasy contamination, which is really just kind of going in and spoiling the fantasy, where we take all the good parts and kind of forget or ignore all the stuff that goes with acting out, right? The remorse, the shame, the trauma to our partners and all that, those we gloss over those. So that making it unattractive is really that kind of idea of fantasy contamination. And then the third thing he does is the response, that cue stage, make it difficult. You know, make a bad habit impractical to do. So what does that look like? Increase what he calls increase the friction, so you don't until you don't even have the option to act. So we talk with addiction recovery about putting up all kinds of barriers. Those could be electronic things on your phone. It can be distance. It could be sort of removing stuff from people, places, and things. It's just making it as hard as possible to go between the impulse and the acting out. And the more of those barriers we can, and sure, can we overcome them? Yeah, if we really want to get to that addictive behavior or substance, we can find a way. But what this does, it gives us a chance to not succumb to the impulse itself, but it buys us time. So we make that response difficult. Then the fourth thing is the reward, make it unsatisfying. And he notes that we're less likely to repeat a bad habit if it's painful or unsatisfying. So for example, an accountability partner in this case can create an immediate cost to an inaction when we care deeply about what others think about. So if we care what others think about it, and we have an accountability partner, it might be that that's enough of a barrier to make us think twice. So the acting out is actually going to cost us socially. We may have shame, we may have embarrassment. He has another one, a contract like we do with our recovery plan, 3 circle plans, right? We look at that as a contract. It can be used to add social costs to the behavior. So he takes each of those cues and cravings and rewards and all those 3 stages and really deconstructs the habit. And this has been a really quick survey. I don't do it justice, but I'd really encourage everybody to, if you're interested in this stuff, it's James Cleary, Atomic Habits. And it's a readable book, it's practical, and it just has the best information on just practical tips on how to break a habit that we all need how to do in recovery. So I'll stop there. Thank you.
Two things at once. I was looking him up. I think it's Clear, not Cleary.
Oh, it could be.
Yeah.
I thought it was.
Yeah,
Okay.
I just looked up. I thought it was Cleary too, and then I looked it up on Amazon, and it says
Okay,
Clear.
thank you,
So,
Scott.
anyway, it's either Clear or Clary for his last name, but the title is Atomic Habits, and there's only one book called Atomic Habits. Quick question: could you explain the cue again? I didn't quite get it. Can you just kind of explain what that is and how it starts the habit?
Right. So a cue basically is some kind of a bit of information that will lead us to a reward that we start to associate with getting that reward. And so, and it's not inherent. The cue can be random, as I said. So it really feeds into our mind, which is constantly kind of always scanning for rewards. And if we get that reward, whatever led us to that reward the first time, we notice. The brain goes back and say, "Oh, how did I get here? This feels good." and it looks at that cue that immediately preceded that activity. So
So it's the trigger, kind of?
basically, yeah,
Okay.
cue, yeah.
I always think of Q as like a big long line, and maybe
Right.
that's the first step in the big long line of things that are going to happen with the habit.
Yeah, exactly. And the thing
Okay.
with sex addiction, with dopamine being so high, everything can become a cue. You know, a song, a place, a person, a car. It just, and it's so random, but it becomes highly individualized. And it's really important for any addict to kind of look at their cues so they know what they're doing and how to
Yeah.
sort of deconstruct them.
Yeah. So when you were talking about like making it hurt, you know, having the accountability buddy, contract, you know, creating some consequences, I immediately think about a swear jar, you know, where you drop an F-bomb and you throw $1 in the jar, and you know, but I also want to know if, like, sometimes teachers use what they call a marble jar. When the class is good or they do well, they put a marble in the jar, and but if they do bad, they take a marble out of the jar. And when the jar gets full, they get to have a class party. So it encourages good behavior. Does positive reinforcement work in breaking habits too, or is it mostly the negative stuff?
Actually, yeah, positive habits give us that dopamine burst as well, right? So it's just more rewarding in a good way, in a I guess pro-social way, pro-health way. So yeah, it absolutely does. But it's almost, you need both going at once. You need to kind of deconstruct the addictive cues, right? So they don't have the power anymore, they don't work as well. But at the same time, you need to kind of replace those with more positive oriented. And that's where I see the outer circle stuff,
Yeah.
you know, in recovery plans, right? The other sources of dopamine that aren't as intense as sex or porn, but over time can be much more satisfying. And, you know, those can be everything from music, food, people, connection, sports, I mean, your dog or cat, anything. So, yeah.
Yeah, that's why I kind of like the idea of a marble jar, because it works both ways. You know,
Yes.
when you're good, you get an extra marble. When you're bad, you lose a marble. When we fill up, we get to celebrate.
Nobody wants to lose a marble. I've had that.
Oh, nobody wants to be the one who cost the class a party. Heaven forbid. So, and not all habits are bad. Or am I wrong?
No, I mean, that's the thing. It's like, even addiction, our brains are basically learning machines, right? And we teach them how to learn to be addicted. The brain is doing what it's supposed to do. It's learning, it's helping us, give us rewards. It's just wherever we steer our consciousness kind of steers the brain too. And so, yeah, the brain operates on habits. Otherwise we'd have to be consciously thinking about everything we do all day long. You know, go make a cup of coffee, you'd have to be consciously, but instead of just kind of being automatic. So habits aren't the enemy. It's just when they get applied toward destructive behaviors, they turn into something we want to lose.
Yeah, so habits, we talk about with sex addiction, we burn pathways in the brain, basically. You know, when we learn to walk, we burn a pathway in the brain.
Right.
You know, you watch a toddler learn to walk, they're stumbling around, they're like thinking about every little movement.
Exactly.
But then they burn that pathway in the brain, and 3 weeks later, they're tearing around the house like, you know, an Olympic sprinter, and banging off of things and, you know, whatever. They're wreaking havoc once they learn, you know, and they never think about it again unless, you know, they have a stroke and have to relearn how to walk or something.
Exactly.
And habits, they do the same thing to our brain.
Yeah. The example that's often used explaining this is driving a car, where you have to, when you first learn how to drive, you have to, you know the gas and the brake and the gear shift, but after a while it's just so automatic, we get in, we don't think about it. But at first it's a very conscious process, and so it's just it's the brain being efficient, and it makes our lives much more I think robust, because we can do a lot more things than we'd have to do if we consciously thought about every single movement we ever make.
Yeah, and you know, I have a habit of turning left out of my neighborhood because 98% of the stuff I do in my life is left. There's only one road out of my neighborhood down the mountain. But, you know, even when I mean to go right, I usually turn left and then have to go, where am I going? And then I have to turn around because it's a habit. I don't even think about it.
Right.
I mean, it's not a particularly bad habit. It's what I normally do.
So this is so interesting, because the brain has this tendency to like routinize everything, right? To drop in habits so it can free up its mental capacity. But they talk about this in kind of keeping your brain vital. If we start if everything starts to be a habit where we're not really actively engaged, if we drive to work the same route every day, we eat the same stuff every day, we see the same people, the brain drops into kind of this lull, this automatic habit mode, which isn't good for us in the long run, which is why they say to kind of keep your brain active and vital. The brain loves novelty. You know, I think a trip, and one of the unfortunate aspects of COVID is that we can't travel like we used to, but going to someplace different with new smells and sights and people and habits, and that's a perfect way to kind of jar your brain and wake it up. So I think we need that. We need.
Yeah, and that was actually one of the joys for me of early sobriety, after I got through early sobriety. So like maybe year 2, year 3 was I started exploring the world again.
Yes.
And seeing things like I was a little kid. You know, I had talked about it like I had fresh eyes. You know, everything looked new and different because I had changed basically everything about my life. You know, because it had become so small and so habitual in the addiction that it was a real joy to open it up. So, yeah.
Cool.
Anyway, all right, let's jump into questions. Hi, I have recently been reading Running on Empty and have been introduced to the concept of alexithymia, the lack of ability to identify and describe emotions. I recognize this in myself. Any advice on how to move forward on that? It's seriously impeding my ability to work on the healing of my relationship. Thank you. It's awesome that you recognize that you're having this issue. And David knows a lot about this. So.
Yeah, so alexithymia, as you mentioned, the inability to identify feelings, which is a very typical symptom or result of addictive behavior, right? Because the whole idea of our addictions, whether they're behaviors or drugs, is to kind of disconnect us from uncomfortable thoughts or feelings. And so over time, we kind of get disconnected from it. And so very often, and we've talked about this before, when somebody comes to a place like Seeking Integrity, they have very little kind of vocabulary for feelings. It's really hard to identify what they're feeling. I remember in my own early recovery, I just felt bad. That was the only word I had for it. And we kind of expand. So we give our clients a couple of different ways of kind of identifying feelings. So as a result of recovery and addiction, I think you can start especially if you get feedback from other people and make some effort, you can start to build that range of emotion and feelings. And that's a little different, I think, than actually a diagnosis of alexithymia as kind of a descriptor. But alexithymia itself, I think, really takes, and I'm not an expert in the treatment of that outside of addictions, but I suspect it takes some more kind of behavioral therapies and maybe even physical therapy, occupational therapy. I'm not sure which specialty that would be, but I think it takes some more work in that regard. I would say most addicts, as a description, they might be described as alexithymic, but in terms of a condition, I would say most don't have that. Now, and again, I can't really elaborate on the treatment of actual alexithymia. It's not my area at all, but it's really important that you've identified that. And I would just make sure, I guess I would just kind of do what we call a differential diagnosis, right? So we have something that looks something, we know how it looks on the surface, but it may be different causes for it. And as I say, it's very common with addiction, but you may have something else besides that too.
So if this individual came to treatment, this is something we would probably want to rule out or at least note and pass along to a future therapist. Like, this may be an issue, alexithymia, but it may clear up with recovery.
Exactly.
And there are a lot of issues that clear up with recovery, like depression and anxiety. Not always, but for me, you know, I still suffer from depression and anxiety, but nothing like when I was in my addiction. It really cleared up a lot. That's pretty common, right, David?
Absolutely. And I think I'm always a little dismayed when somebody in early recovery gets diagnosed with some serious thing like bipolar or schizophrenia or even major depression, because a lot of the symptoms, or psychosis from methamphetamine, a lot of those symptoms clear up. They're the result of the addiction or the addictive process. They're not underlying disorders themselves. So I think we need to give my rule of thumb is 3 months. And, you know, we can stabilize behavior, we can help control behaviors. If somebody's severely depressed, we need to obviously address it. But I think to actually say, okay, this is something called major depressive disorder, as opposed to just depression related to the addiction, that takes time to kind of tease out. So it's same, bipolar is another very common one because people, when there is the intensity addictions, it's all arousal situations. And so
and hard crashes.
and yes, exactly. And so very often people are misdiagnosed as bipolar when it's really just the process of the addiction itself. Now, talking about differential diagnosis, when we look at sex addiction, we have to actually determine, okay, is this behavior the result of an addictive disorder, or is this really bipolar? Because bipolar and a manic phase can look very much like a sex addiction, or is this some kind of organic thing with thyroid or something else? There's all kinds of things that can affect it, or a Parkinsonian drug like L-Dopa that can do the same. So there's many different causes. So we and I'm not a physician, but we have to kind of at least be aware of it and know enough to say, oh, I need help on this one because this may not be what I think it is. So but the great thing about Seeking Integrity, just if I can put on a plug, is that we are really good at parsing out some of these issues and kind of laying out a framework for the recovering person, saying, okay, this is where we see you have a problem, this is what we think you should do, and so on. And we do have, we can consult on our team with psychiatrists or neuropsychologists, and so it's good. But that awareness is important to have.
Yeah. I mean, 20 plus years ago, I was diagnosed with schizoid personality disorder, which has nothing to do with schizophrenia, but it basically means I'm an extreme loner. But I was also active in my addiction, and I think if we did all that testing again today, they'd be like, no. Yeah, you're a little bit of a, an island, but it was part of my addiction to cut myself off.
Right. And the same thing we see a lot in with sex addiction, with narcissism and even antisocial stuff, because a full-bloom sex addict can be pretty narcissistic and pretty antisocial in some of the things they do sometimes. Does that mean they have a narcissistic personality disorder? Usually not. Sometimes, yeah, it could happen, but it's rare. I think more often there's tendencies or traits, but it doesn't meet the criteria for an actual personality disorder in most cases.
Yeah, and true narcissistic personality disorder is really difficult to deal with clinically.
Yeah.
And
any personality disorder is.
Yeah, personality disorders are tough. So, okay, I'm a very ambitious person who wants to accomplish a lot, as well as an intensity addict, sex and porn. How do you reconcile the two? Because sex and porn, as you hear us say a lot, are intensity addictions. How do you go about accomplishing your ambitions in a healthy way? This is a great question, because we have a lot of, particularly in the treatment center, we have some really high achievers. Doctors, lawyers, pilots, guys like, top of the heap kind of people.
Right, very
Super
often.
ambitious, but they're intensity addicts and have, day traders, stockbrokers, things like that. How do you reconcile?
It's a great question, because we do, on occasion, we've had like ER docs, for example, who these guys are sex addicts and porn addicts and emergency room doctors, and they got off on the intensity of like the next case coming in and just one after the other. And we've actually made recommendations sometimes for them to get away from the ER for a while, teach or do something else, because it was very hard for them to do what you're trying to do, which is to separate the intensity of the addictive process from other kinds of intensity. And so when those get blended, it's very difficult. I think we see people that do high impact sports and risky things and get that need for intensity out in other ways. I think I would take a really serious look to start at your addictive behavior, make sure that you get some good solid recovery under you. And I think then start to see how you can maybe channel some of that ambition and intensity into what I would call pro-social things, right? With a warning here, because what we see typically with a lot of sex addicts is they're searching for an outlet because it's still, especially in early recovery, it all hasn't taken yet, because we have to do the inner work too to reduce some of that, the boiling intensity on the inside, but they're looking for an outlet, so they drop into work. They've given up sex, they've given up porn, suddenly they're working 80 or 100 hours a week, which isn't healthy either, obviously. So just I would encourage you to maintain balance. Once you get your addictive disorders under control and you're starting to look at these other areas of your life, really, I would have some accountability people who, because we're not very good judges at saying, okay, this seems like a balanced lifestyle, and we can be way off. So I'd get some people to give you feedback. I think it's okay. Some people are just wired this way. I've had clients who gave up meth who are just still hungry for something, to get the adrenaline going and the dopamine. So I've mentioned this example before. The guy I'm thinking of wanted to go parachuting to get that, thrill. But Scott was just talking about kind of loner, which many addicts are. He wanted to do it by himself. I suggested, why don't you do it with a group of other recovery people, which he did. He found 4 or 5 other recovering meth addicts, all doing well, who also really thrive on the intensity, and they went together. And so he met his intensity need and he met his group connection need. And but the only thing is to just keep it in check, because that you're kind of walking the tiger every day. You have to really be careful not to let it turn around and bite you. But I think balance is the way. And I think very often we don't have a good sense of balance ourselves. So I encourage you to get some outside input on it.
What should I make of my sex addicted husband who, after 5 weeks of residential treatment, took me off of his email after I saw info in the email indicating he's not in recovery? We're separated. When I mentioned that experts state transparency is a good thing, he audibly sighs and doesn't want to hear it. So we've got a sex addict who's maybe not in recovery and doesn't want to be transparent and is getting a little fussy about it.
Yeah, I mean, these are all bad signs, right? 5 weeks in treatment is a long time investment in both time and money. And then to start to go underground again and do some of these covert behaviors, and I know no doubt blaming as well. And you don't say that, but that also goes with that. He audibly sighs.
It's like, yeah, that's a blame.
Yeah. So So I think this is troubling. I think what you need to do as a partner is work on your boundaries and what's okay and what's not. And there's some things clearly that aren't. You've said you're already separated, right? Still separated. So I think just, first of all, you need to carry you and make sure that you're okay and not being triggered by all this. And of course you're going to be, but it's how you manage those. But I would really work, if you have a therapist or someone who can advise you, work with you on boundaries. What do you need in this situation? And you may need more distance. And certainly if you're thinking about reconciliation, these would be factors that would have to be included in that formula. But I think, this is concerning to me.
Yeah. And if you haven't set your bottom lines, like, this is something I absolutely will not abide no matter what, and this will end the relationship. I mean, everybody has their bottom lines. They differ from person to person, but you should at least know what they are. So if you haven't kind of figured that out or tried to figure that out, I would suggest, particularly if you have a good therapist and a good support network, really figuring out that's the real boundary. It's like, you cross this line, we're done boundary. And then you can work on other boundaries that are, if you want to stay with me, this is what the boundaries look like.
Yeah. So. And I think you have to be really clear with those, as clear as possible and firm.
Yeah. Don't set a bottom line boundary that you're not going to keep. A bottom line boundary is a boundary you're going to keep.
Right. Has to be.
So is it possible to incorporate masturbation without porn back into the circle plan? I relapsed to YouTube porn, and we call that not porn, because technically it's not porn, but we use it like porn. So and sometimes there is actual porn on YouTube, although they're trying to crack down. I relapsed to YouTube porn after 4 months of no porn and no masturbation. I was mostly having wet dreams due to abstaining from both. But my addict mind thinks incorporation of masturbation without porn will help me avoid seeking porn. I also have a partner, but our sex frequency is infrequent, once a month or so, due to my psychological erectile dysfunction issues, which are probably tied to sex and porn addiction. We can talk about that in a minute. But David, the first question, should this individual reincorporate masturbation back into his or her plan? Well, his, if he's having wet dreams.
Yeah. So, I think you kind of answered the question yourself, right? Because it led to a relapse. So I think certainly, at least for now, it probably needs to stay in your inner circle without porn. Obviously, porn should be in there too, because those two things are fused in your mind and go together. When we start to masturbate, I think too soon in recovery, we talked tonight about, in the beginning, about habits and how those things get deeply grooved. And when you look at porn and masturbate for a habit and then get in recovery and try to go back to just the masturbation piece, your brain is going to go right along because there's all kinds of cues there that's going to bring in images of porn. You're fighting your own brain at that point. So I would definitely keep them separate on the road for sure.
Yeah, somebody asked me once, is it possible to masturbate without having fantasies? And I laughed and said, not in my experience. And I think that's everybody's experience. We masturbate to fantasies. And the fantasies, if you're a porn addict, are going to be porn. You're going to go back to porn. You can try to fantasize about your wife, and you might do really well for a few minutes, but and nobody ever died from lack of masturbation.
Right.
Okay, I cut you off, David. You were still talking.
Sometimes I make a distinction. What is the intention of the masturbation, right? And this is down there. This is my sex therapist talking there. Down the road, after the kind of compulsive things might have separated a little bit. And I think it's important to ask yourself, I want to masturbate. What's my intention? Is it to soothe myself, go to sleep, relieve stress, relieve boredom, all that stuff? Those are not good reasons to masturbate, right? Those are ways to check out and soothe myself in a very addictive manner. If I want to masturbate to pleasure myself, to feel good, to feel connected, that's okay. But I'm present, I'm connected, as opposed to checking out a little bit on the other side. So that's a very black and white way of kind of starting to judge those. But in the specific circumstances here, I would say you need to keep those totally off limits for now.
Yeah, revisit it at the year mark or something, and don't start up again without consulting your support network.
Right. Let's talk about PED for a minute too. So
let's talk about porn-induced erectile dysfunction, or that sexual dysfunction that sex addicts have. Pat Carnes did a study a long time ago with a couple other people, and one of his findings was sex addicts are actually really bad at sex, and this is why. So go ahead, David.
Right. So I'll start by describing a phenomenon that we started seeing with all these young men who have really grown up on porn. They're of an age where cell phones were common, porn was free, it's cheap, it's on their phone, it's private, it's ubiquitous. And so we're seeing these young guys who are basically porn addicts. They've got 10 years of porn under their belts when they're in their 20s. And suddenly we're seeing erectile dysfunction among these young men who have no physiological reason to have any kind of erectile dysfunction issues. And it's called porn-induced erectile dysfunction. And it's simply what happens with any addiction. There's tolerance builds up and escalation builds up. We go higher and higher in the intensity. And eventually we reach a point where nothing, including, well, I won't say that. We reach a point where the porn has so hijacked our arousal template that our human partners are no longer attractive to us. And you think about porn is a new, with novelty is what dopamine wants, right? New images. So with porn, you look at a new image, every second, every 2 seconds, one after the other. We're just constantly we're training our brain to need some new stimulus every couple seconds. And that just doesn't fit attraction to a human being who is a human being, right? They're not changing every 2 seconds. And so what they found with these young guys is that they would have erectile dysfunction with their partners, but as soon as they looked at porn, they had no problem because they could keep escalating and controlling it. So we know that this is a phenomenon. And I would bet if you can stay away from porn and masturbation, in most cases, especially if you're younger, that erectile dysfunction will resolve itself. It's a matter of time. Now, you can screw it up, however, with fantasy. We were talking about fantasy just a minute ago. So you can not look at porn, but if you still are thinking about sexualized images in your head all the time, that's almost the same thing to your brain. And so you have to really kind of stay away from the fantasies with or without porn to just really kind of let your brain reset, if you will, back to kind of normal levels.
And I just want to add, I mentioned not porn earlier. YouTube is famous for not porn. Instagram is filled with not porn. If you're a porn addict, you don't need to be on YouTube or Instagram or most other forms of social media, because technically they're not porn, but it's very easy to find stuff that we can use the same as porn. There are TV shows I don't watch because I can use them the same as porn. There are movies that I just don't need to watch, and they're good movies, some of them. I don't need to watch them because I will use it like porn, even though it's, a rated R movie. So you have to be really aware. And if you're a porn addict, I mean, your inner circle should include porn, and for you, probably masturbation, the asker of this question, and not porn. You need to be really, really aware of it, because it'll drag you out.
I routinely ask my clients not to get off social media because the thirst trap pictures, they're called, just there's so much of that on the social media. It's just it's
and
virtually
sexual
the same thing
dysfunction issues. With my porn addiction work group, we talk specifically about porn-induced erectile dysfunction, and everyone in the group will go, like everyone, regardless of their age, they all go, yeah, had some of that. It's really common, but you can heal, as David said. You can heal 6 months, a year, somewhere the brain starts to reset. If attention seeking is one of the acting out behaviors, what would be the cue? So what would trigger attention seeking as an acting out behavior?
That's a great question. So if we work backwards, right? So attention seeking, what's the goal of attention seeking? Typically some kind of validation often. And most addicts, most sex addicts especially, are real validation seekers. And so what would make me want validation from outside? Probably not feeling very good about myself, feeling lonely, feeling unworthy, feeling having some body shame, just anything that makes me feel less than or unworthy. I think that typically, there's probably many more. As we said at the beginning, you can have an infinite variety of cues and or triggers and the result. But in most cases, when I see this kind of attention seeking, it has to do with validation, and it has to do with kind of soothing this inner feeling of somehow I'm not enough. And that's, I think, a typical cycle there. I just want to say about sensation seeking, which is slightly different than this, but sensation seeking is that need for stimulus all the time. And we see that's very common with sex and porn addicts. We call them intensity addictions. And there's a lot of really cool research now looking at the role of trauma with people that sensation seek. And it's a direct correlation between trauma and sensation seekers and intensity addictions. And so those things are all kind of one big ball of stuff. And we know that there's actual studies too, that the more trauma somebody might have, they move out of sensation seeking and actually PTSD. Those are related as well. So it's fascinating, but that's slightly off topic from the attention seeking, but we're always, the theme here is that we're always looking for something outside of ourselves to fix something inside of ourselves. And that's the basis of addiction. And recovery is kind of the flip, right? We want to start to develop those internal skills and values and beliefs about ourselves that are positive, so we don't need a fix. We don't need it from a drug or a person or an act.
We've got another sexual dysfunction question. Due to long-term porn use and masturbation, this person has gotten used to ejaculating only when he's in a certain position. This is creating difficulty in terms of having sex with a partner. In addition, sex with a real partner feels cumbersome and is a little bit of a turnoff. Is there a way to fix this? How long will recovery take? And I'm going to add one more question. Will Viagra and the similar drugs help?
Okay. Let me start with that one first, because we were just talking about ED, then I'll come back into this. So with erectile dysfunction, a lot of guys obviously turn to the oral erectile dysfunction drugs, which in a healthy, normal person only work about 80% of the time anyway. So 4 out of 5 times they work, 20% they don't work at all. Now, when we add addiction to the mix, they even drop much more significantly. And the reason, if I can simplify it, is that sex, of course, starts with an image in the brain, right? It has to.
The problem is up here, not down
right,
there.
The problem is here. So if we get aroused for whatever reason, our brain sends a signal down to our genitals, right? And so that signal comes down, and then at that point in men, 2 different chemicals are released that, through some different mechanics, allow blood to flow into the penis and erections formed. And so what those drugs like Viagra and Cialis and Levitra, all of them, what they do is they work on those 2 chemicals down in your genitals and help give those kind of a little bit of a boost. But if you don't have the signal coming from up here in the first place, they're not going to work, because they only work once the signal arrives. And we know from what we've just said, porn and sex addiction, all that escalation tolerance makes it so that signal is extremely rare, if impossible to have. So those drugs are not going to work as well. There's other medications that do work more mechanically, but they're more extreme, I would say, like the injectables. Now, in terms of this,
what is the solution for this individual?
Sorry, Scott?
So what is the solution for this individual?
Yeah, so, what I would say, where we get so kind of rigid into specific patterns and sequences and physical areas, I think just to try to break those patterns and lighten up and loosen up a little bit. If you have a partner, oh yeah, right, although there may be erectile dysfunction, but I would recommend just spending more time relaxing, not focusing on erections and orgasms. Sex is a whole lot more than that. So I'd focus on touch, I'd focus on connection, I'd focus on hugging, I'd just focus experimenting. And gradually, I think you've taught your body how to only do that. If you kind of deconstruct that, it'll start to loosen up. I've had clients who could, only climax, positions like this, or standing up, or only lying down, or with their legs stiff. All that can be changed, right? Those are all learned behaviors. It just takes time and patience. I've mentioned this all the time. I'll mention to you too. It might be helpful, that Masters and Johnson Sensate Focus exercise, which you need a partner for, but it's a intimacy touch, give and take exercise that also helps just rewire some of these responses in our bodies. Your body is very adaptable. It's just your brain is keeping you locked into this position. So I just kind of loosen up a little bit, relax, maybe massage to start, and just enjoy it. And I think and this is hard to say, hard to do rather, but don't focus so much on the orgasm and the erection. The interesting thing about Sensate Focus, which does not have a sexual component in the beginning, it grows into that, but very oftentimes it's used for couples who are having trouble having any kind of sexual interaction. And just by taking the focus off it, taking the pressure off it, and communicating, giving pleasure to each other in different ways, suddenly they get an erection, right? So it's our brain kind of freaking out a little bit. So just takes, what else helps? And I'm going on too long. Breathing, deep breathing, really like in through the nose, out through the mouth, always exhaling for longer than the inhale. That also can kind of reset your body and relax you in a way that your body is much more receptive to pleasurable sexual activity, I'll put it that way.
My porn addict played sports intensely from age 5 to 22, then turned to porn. How do you get someone like this to slow down? I can tell you my porn addiction took off when I blew my knee out and couldn't play sports anymore. So replacement, but how do you get somebody like that to slow down? I mean, this is the intensity addict all over again.
Right. I think, we see the same thing, by the way, with gaming. It's not the physical component, but it's the same thing. Gaming is really kind of a gateway drug into porn addiction from my point of view. I think, again, it's channeling it into healthy activities, right? Some people are kind of wired this way, just wired for intensity, and it gets, remember, addiction, especially sex and porn addiction, is not about the sex and porn. It's about relieving something in us or numbing us or distracting us. And so I think doing some deeper work, what's going on here? Is there shame issues or some kind of core belief or some trauma? Or I think there's something probably driving the addiction. So that has to be addressed. But also on top of that, similar to what we said before, I think the behaviors need to be just channeled and regulated and balanced. So physical activity, maybe marathons, or maybe some kind of ongoing thing that really wears people out. Also, by the way, sports, there's usually a competitive piece that's very attractive to intensity addicts, and it's what makes gaming and some other things gambling so appealing. So I think maybe some kind of sports where it's a little competition, well, wouldn't be necessarily a bad thing. But I think, again, we are terrible at judging what is balanced. Is this too much, too little? So we really need outside help evaluating that. And so I would make sure this person's connected to a sponsor and an accountability partner and maybe a therapist to help work through these things. But I think this is a pretty common scenario. And we can't just say, don't be an intensity person. People are kind of wired for that. But I think sometimes there's an underlying psychological aspect to the problem. Sometimes people are literally running from something and distracting themselves. There's a lot of work now with the physical sensations of trauma and the physical sensations of an intensity addiction and how similar those are. The fight or flight, there's heart rate issues and stuff. So sometimes people are trying to replicate the physical activity as well as the need itself. So I'd recommend actually talking to a therapist as well. They might give you some good insight and get some good tips.
Yeah. I'm going to jump down a little bit because I want to get this question to you, David. My husband sometimes watches TikTok with my 15-year-old daughter. Should I set a boundary about that? There's a lot of layers to that.
Yeah, so TikTok, we were talking about not porn a few minutes ago. I think TikTok falls into that category in my view. There's a lot of stuff that we can fantasize about on there. I think it's lovely that your husband is doing something with your daughter. I encourage that. I'm not sure watching TikTok is the best thing to do together, but I think that kind of bonding is tremendously important for both of them. But I think watching something together is kind of a passive activity, and TikTok, I think, is not the best content for that. So maybe they could do something together, take a walk or do some activity together, play tennis or something else. But I think, yeah, what disturbs me about that a little bit is TikTok itself, the subject matter, but also when we're watching a screen, it's very passive. And I think it's the same thing why I don't recommend pornography for a couple to spice up their sex life, because what happens is both members of the couple start attaching to the porn and not to each other. And I think just I'd be cautious about that. Scott, do you have thoughts on that?
Well, yeah, I mean, it's so layered. I mean, I love that he's doing something with your 15-year-old daughter. 15-year-old kids are really hard to bond with.
Yeah.
And they think their parents are uncool, and he's probably watching it because she thinks TikTok is cool, and he's like, so he's probably not using it to act out, particularly if he's sitting there next to his daughter. But
hopefully,
at the same time, TikTok is full of not porn. I mean, if she's really into TikTok, maybe they could make a stupid TikTok video.
I had a friend who made a video with his daughter, a little younger, like 11, but they had a blast, and it was a great thing.
Yeah, I mean, that could be really fun and and healthy, and still involve her with TikTok, which teenagers love. But yeah, sex addicts not so much. So yeah, that's a tough one. But yeah, I've been sober for 2 years. I've been in good recovery for about 1.5 years. I attend several support groups and 12-step meetings. I meet with the CSAT weekly, regular check-ins with my wife. I read relationship and recovery books, and I do recommended work to increase my emotional intelligence. I'm working very hard on correcting my character defects, decreasing my shame, earning my wife's trust. I am happier and have more self-esteem than I have ever had. However, I still do not have empathy for my wife when she talks about her feelings. I am able to keep my shame at bay and stay present, but I don't know what to say. I try to acknowledge, validate, and reassure my wife, but what I say sounds scripted and insincere. Ultimately, my attempt at expressing empathy completely misses the mark. My wife is very understanding and patient, but I know my lack of empathy hurts her. How do I learn to have empathy for my wife? I absolutely love this question, and I love that you asked it.
And I just want to say, wow, good for you, because you are working hard and it shows. All the stuff you're doing, that's wonderful. And you're so on the right track. This empathy thing is so hard for so many people. And what I've been doing more recently is using some material from dialectical behavioral therapy, DBT. And DBT is kind of a specialized therapy that started out with personality disorders, but it's really useful for addiction. But DBT is just a set of skills. And some of it is mindfulness, some of it's decision making, some of it is emotional regulation. But there's some great work in DBT on starting to establish emotional connection and how to do that and how to read somebody else. And so it's like the building blocks of empathy. And I think a lot of addicts, missed that course when we were young. And it's hard to do, but unless you're a total sociopath, which I don't think you are based on what you just said, you can learn it and you can internalize it, and it can feel authentic, and it will be authentic. But I would encourage you to check out dialectical behavioral therapy. There's a workbook I recommend. I'll get the name of it in a minute. That I just think is really terrific, but it teaches you some of these skills in a very practical way. It's the one I like, Dialectical Behavioral Therapy Skills Workbook, by McKay, Wood, and Brentley. You can't see it. I'll type it into the chat.
Thanks. And I'll just add, when I got into recovery, I actually asked one of my therapists. This was when I was in treatment, so I was very new. When am I going to have empathy? And he laughed and said, probably about 5 years. And it was sooner than that, but it was a process. It sounds to me like you're right on schedule, frankly. Because I spent the first 2 years of recovery kind of going through the motions, and it started to kick in, but it was still more of an intellectual exercise than something automatic. And somewhere around the 4 or 5 year mark of my sobriety, I was sitting in a 12-step meeting, and somebody shared about something really good that had happened to them. And I felt joy. And I was like, and it hit me like, oh my God, I am feeling this with them. And it happens now. It's fairly easy for me to feel things with people. But it was a lot of work to get there, and it was a lot of conscious effort, and it did feel like I was just reading from a script. I understand you're upset, and I understand that this is my fault. I think you might be feeling this. Am I correct? It feels like you're a little robot doing that, but this is how we learn empathy. Because as recovering addicts, we have to either learn it or relearn it. Some of us never had it. Some of us had it and lost it.
Right. Right. Hang in there, though. I mean, you're doing so many things right. I have every faith that it's going to come to you. But it's like Scott said, there's a time frame involved. But and keep going, and especially if you have a partner who's working with you. I mean, because it sounds a little stilted at first, but that's how we learn to do it. And keep practicing, keep checking out what you're thinking your wife might be feeling, and check it out, and just keep it going, keep that conversation going. And I did, right. You said daily check-ins, you said regular check-ins. I think I recommend for my couples to have daily, like even 10 or 15 minute check-ins. And they're really useful because they start to regularize that contact, you start getting used to it. And then that also starts to build the flow in even a nonverbal way. That connection is really important. So try it. I'll give you one other kind of little woo exercise, and I'll run out of time, that we do sometimes. And that's eye gazing, which sounds a little funny, but eye gazing, left eye to left eye, can be really powerful, and it's hard. Do an eye gaze, try it for like 60 seconds. It will seem like 5 years, but it's also a great way to kind of reactivate some of that neural circuitry we have that helps us with empathy. So it's a great little tool.
Yeah. And I mean, I couldn't have empathy for somebody else because I couldn't identify my own feelings. And it took me a couple of years to start really actually recognizing my own feelings, and then a couple more years to be able to recognize other people. There's this thing called emotional intelligence, and that's, you know,
Right.
recognizing our feelings, recognizing someone else's.
And very often the stepping stone is an animal, right? Cats or dogs, humans can relate to because they're much safer and they're unconditional, but it can be a building block for empathy as well. It sounds kind of bizarre, but it actually can work.
Yeah, I agree totally. Somebody asked, noticed we were recording this, they asked how they can catch these. I know we told you stay off of YouTube, but we have a YouTube channel called Sex and Relationship Healing. So if you go on YouTube, go directly to Sex and Relationship Healing. We post them there. You can also put them on our website. You can find them on our website on the landing page for all the webinars and drop-in groups. There's a button that says view previous webinars, and that'll bring up anything from the last month. I roll them off after about a month to make room for new ones, but they live on YouTube forever.
And they're not porn.
Yeah, they're not porn. They're good YouTube content. So we're out of time. Thank you everyone for being here. Thank you, David. Great topic today. Very cool stuff. I will get this posted probably first thing in the morning, because a couple of people have said they want to have this one again. So it'll be up in the morning.
Cool.
We'll be back same time, same place next week.
All right, good. Take care of yourself, Scott. Okay, ciao.